Welcome back to the Morning Blend. October is Breast Cancer Awareness Month. According to the American Cancer Society, nearly 1,700 Nevadans will be diagnosed with breast cancer this year. Receive specialized care with the help of our next guest.
Breast surgeon Dr. Suzanne El-Eid joins us from Comprehensive Cancer Centers of Nevada. Patient Carolyn Zirkle is also with us. Good morning to both of you, and thank you so much for coming on.
Welcome
Good
in.
morning. Good morning.
Now, doctor, she is your patient. She went through a traumatic experience that is happening right now. Can you tell us what happened to Carolyn?
Carolyn came to me with complaints of nipple discharge. And she's young. And she told me she thinks at the same time she's pregnant. I said, okay, nipple discharge with pregnancy is normal, hormone related. But she was persistent. And she said, no, this doesn't feel the same. And which led to an exam, ultrasound. I saw the lesion, biopsy, and then finding cancer.
Wow, good eye. Well done. So what are the red flags then that we should be looking for if a woman is, or particularly a man, it can happen to a man as well, they feel that something could be wrong with their breast? What are some of the things they should be on the lookout?
So we say people should be aware of their bodies, especially their breast. If there's any skin changes, redness, puckering, a lump, nipple changes, all of a sudden it becomes inverted, or discharge, nipple discharge, or sometimes a lump in the armpit that shows up where the cancer starts in the breast and goes to the lymph nodes.
Wow.
And so any changes, and they should come to their doctor and ask for help.
And it's critical to catch it in the early stages, breast cancer.
Breast cancer is curable in early stages. 100% cure for stage 0 and stage 1.
Wow.
90% for others. That's why we do screening with mammograms and exams. This morning I saw in the news that the American Cancer Society changed their recommendations to start at age 45. I don't really agree with that. I still believe it should be at 40. If she's higher risk by family history or genetics, even earlier.
Yeah.
But Carolyn, I mean, you didn't have a family history, did you?
I have no family history, and I am 30 years old.
Yeah, you don't
so
seem like you're 40, 45.
I don't fit those descriptions.
Your gut was telling you something was wrong, and that's why you were very proactive in saying, this is not normal.
Yes, it was just something happened out of the blue, and I waited a little while, a few months before I saw a doctor, and I thought, this isn't going away, so I need to either be told I'm in the clear or something is wrong and we have to fix it.
I think it's important for people to know that the cost is not incredibly high to get this done throughout the year, should you feel the need to get it done, regardless of what insurance may say.
That is correct. And unfortunately, I see many women who have not had a mammogram for the last few years because they didn't have insurance. But every state has their rules and they
Guidelines.
and guidelines. And usually in the month of October, because of the raising awareness, many programs are out there offering mammograms at discounted rate, out of pocket, $50.
That's great.
Now, Carolyn, where are you right now? How are you feeling?
I'm feeling great.
Fantastic.
I'm about 7 months pregnant. I did the single mastectomy, so after the pregnancy, I'll have another surgery or two to do reconstruction.
And you found out you were pregnant at the same time?
At the same time. So it was, you have to have surgery, but we have to find out if you're pregnant and what precautions we have to take.
So there's joy and sadness and all these emotions running through at the
Yes.
same time. And obviously, your family very supportive.
Yes, so my first thought was always, my concern is the family. I have 2 little girls already, and also with the pregnancy, whether or not I'd be able to keep the baby or the baby would last through surgeries. I had 3 of them. So, but I have a great support system at home and at work that helped me get through the recovery.
Is testing different for somebody that's pregnant as opposed to somebody that isn't?
Yes. So when the woman is pregnant, you don't really want to expose her to radiation.
Of course.
A mammogram is radiation, low dose, but radiation.
Yeah.
So we use shielding, but at her age, again, we wouldn't do a mammogram, so we look with an ultrasound. When we find cancer, then we want to stage, so we usually do CAT scans, PET scans, all that is radiation. MRI, we cannot do it on a pregnant woman.
Wow. My
So
goodness.
you're limited in the options that you have.
We are limited. It's hand exam, ultrasound, and then if there is cancer, then The high-risk obstetrician has to be involved. If she needs surgery, the general anesthesia, any drugs we give to the pregnant woman, we're giving also to the baby, whether it's chemotherapy, general anesthesia, and so we have to be careful of 2 lives, not just one.
So regardless of whatever you might see in the news, you should start at 40, 45. If you have a family history a little earlier, you are under 40, you didn't have a family history, what do you say to people and knowing when something's wrong?
I just say know your body and be persistent with your doctor, or find another doctor that will tell you you're in the clear, because I was one of those people that was told you're too young for a mammogram and you have no family history, you're okay to wait. But because I noticed something wrong, I went to the doctors and I said, I just need you to tell me that either this is nothing to worry about or it's something we can fix. Because being persistent, if I hadn't done that in 5 years, who knows where I would have been.
You saved your own life.
Yeah.
You saved your own life.
And so did the doctor.
Absolutely.
Of course.
Well, for people who don't know the recommendations, what are they currently? It's 40 years of age to go in
Yeah,
to get that mammogram.
The NCCN guidelines still say, starting at age 40, every year mammogram. And some guidelines stop at a certain age. I have 90 years old ladies who are active, go golfing. They should be getting their mammograms every year. So as long as you're in good health, you get the mammogram
And if you
early.
have a family history of it, how often should you be going?
So if you have a family history, we calculate the risk, and if the lifetime risk is more than 20, we use special calculation models. If it's more than 20%, we add the MRI to the mammogram. They get examined every 6 months. If they fit the genetics criteria, we do gene testing, and if they have the gene, then we offer them other options according to the gene they have.
Absolutely. Well, it's great work that you're doing, and congratulations on catching
Thank
everything.
you.
And a baby on the way.
Yes,
So cool.
thank you.
Congratulations.
Thank you for sharing your story. October is Breast Cancer Awareness Month. Make sure you check your health. You saw evidence here. Even if you have no family history of cancer, it doesn't mean you're not at risk. To learn more about Comprehensive Cancer Centers of Nevada, check out the website on your screen or call the number listed. You can also follow the group on Facebook and Twitter. Still